professionals and leaders in our table, and we all met today to discuss malnourishment and its impact on hip fractures. Our team was called Hips Can Lie, Hips Don't Lie, but we should have been named Hips Can Lie, at least when there is data limitations. But I don't think that would have reached as many world number ones as the original song. We chose the data because Lara made a very passionate speech about hip fractures, and we all realise that as our population ages more and more, as many people in this room have parents, grandparents, and themselves are probably getting to those ages, more and more of us will experience these sort of issues. And malnourishment is one of the key contributors, or at least this is what we thought, of what happens to patient outcomes after they present for hip fracture surgeries. So our objective was to use the ANZHFR data to determine the impact of patients with a clinical malnutrition assessment on outcomes post-surgery. We to a surgery made a big difference. The other thing that we had with the data is that malnourishment is a clinical assessment and it doesn't really go into deep details of what that actually means. So it could just be an assessment that a doctor makes, and so that's why there's not so many differences between patient results. Even when we looked at the 365 days post-surgery, the differences between the two graphs, as you can see, is very similar for both patient sets. So that's why we then chose the 2024 patient subset, which had data about oral nutrition supplements, and that was one of the things that Lara recommended because there's a nutritionist in their team who has been recommending patients taking various supplements. So when we looked at this data, you could see there was fairly similar splits again between males and females. However, for malnourished patients, the oral supplement percentage was much higher, which you would expect. This nutritionist did also, as an aside, recommend that these oral supplements be done to both cohorts of patients. So when we looked at the 30-day mortality rates for patients who had oral supplements, you could see that the odds ratio wasn't very different for malnourished patients, so it didn't actually show that there was much difference in the mortality rates. When we looked at it for 365 days instead, you could see that the odds ratio increased significantly for malnourished patients, and also when you look at the comparison, the combined comparison of malnourished patients who had oral supplements, the percentage chance of them dying did decrease. The issue is you can't really correlate the nutritional supplements to patients not passing away. There could be many other things like comorbidities, patients presenting with other things, and 1 year is a long time after surgery, so a whole bunch of things could happen to these patients. Also with the patient data set having an average age of, I think, 82. So there's limited evidence of differences in 30 days mortality rates. There's evidence that suggests that malnourished patients have a higher mortality risk in comparison to non-malnourished patients for the 365 days. And there's some evidence to suggest that receiving oral nutritional supplements from the malnourished cohort will have improved outcomes in the 1 year cohort. So with the data limitations, we looked at some existing studies which showed that malnutrition has better correlation when using defined tools, such as the mini nutritional assessments, geriatric nutritional risk index, and serum albumin levels. Malnutrition is closely associated with fracture types with low lean body mass, low BMI, and also bone density measures. As far as we understood, we were one of the first teams to look at malnourishment comparisons for patient outcomes. So the study more talked about other measurement types. So what we suggest is that more patient identifiers and additional demographic data should be added to the data sets, which would allow mapping of specific patient cohorts, patient journeys pre and post-surgery, and admissions into aged care homes and private residence post-surgery. Oral supplements have been recommended by the nutritionist to be provided to all patients regardless of malnourishment assessment, and therefore tracking these patients would allow for further correlation metrics. Thank you.